with the Universities of Columbia and the University of Cochena, Ecuador. Dr. Padermo is also a national and international speaker and has presented in countries such as the USA at the DAMON Forum in 2017, 18 and 19, Australia, the Netherlands, Vietnam, Cambodia, Brazil, Mexico, India, Sri Lanka, Bolivia, Peru, Argentina, Ecuador, and many more. He has written many scientific papers, book papers, and he is the author of the book, The Current Principles of the Self-Ligation System. Ladies and gentlemen, my dear friend and dear friend of Ormco, Dr. Padermo, thank you.
Thank you for your kind introduction, Dane. Thank you, everybody. I'm very, very, very happy to be with you in this beautiful day. Obviously, 7 a.m. in Colombia, 7 p.m. in your area. So I'm really happy again to be with you. It's an honor to present this webinar to you. I was last February in Vietnam and Cambodia talking about a little bit about DAMON and DAMON ULTIMA, beautiful people, beautiful places, and my God, the food was amazing. So I want to come back again. I want to go again to this part of the world, which is amazing. So time flies at the webinar, so I need to start as soon as possible, my dear colleagues and my dear friends. So the title, this is a beautiful pic of some of my cities in Colombia. I'm from Colombia, South America. This is Cartagena, or the north area of Colombia. It's a beautiful city, plenty of beaches and nice food. Again, welcome. The title of the webinar is Redefining Precision and Efficiency in Orthodontics with the ultimate technology. Everything, my dear friends, right now in these times is about technology in our profession. Our specialization needs a lot of technology. I always show this photo because it's a photo that I love, because there are my best friends, my closer ones, is my people at the program, my residency, when I study orthodontics a lot of years ago. My best friend at the Javeriana University in Bogota, Colombia, and it's been a beautiful journey, a journey of about, I don't remember very well, maybe 18 years, close to this amazing guy called Dry Damon. Obviously, friends like Stuart Frost, and even my very first photo was the photo at the top on the left. This photo was taken maybe in 2004, 2005. I was a little bit fat, and Damon was really, really young. And as I told you, it has been a beautiful journey with the Damon system. This is a guy that I love, and I admire him a lot. Okay, the growth of the Damon system, most of you know the growth of the Damon system has been a growth since 1996, and the last and the best, in my way of thinking, launch of Damon is the Damon Ultima in 2021. My gosh, my dear colleagues, it's a really, really amazing tool to deliver efficient and excellent outcomes in our orthodontics treatment. So, Damon Ultima, I have many topics in this webinar. We are going to talk about why do we need another bracket, because we are happy in a comfort zone with Damon Q, maybe with Damon Q2, or maybe some of you with another passive or active cell ligation system. So because of that, this question, why do we need another bracket? What about a new bracket slot design? We are talking about Damon Ultima variable torques, and of course the new Damon Ultima wire sequencing, and obviously I'm gonna show you some cases. Let me check the hour. Okay, 7:07. Check the time. What do we need another bracket? Because we are dealing with these two words, the clearance and tolerances. What is the clearance and tolerances? The amount of play that exists between the slot and the wire in the engineering, term is called clearance. Clearance is this kind of spaces. Look at the green arrows. This clearance fell. That we are dealing with a huge clearance with this lack of exactitude. It's difficult to get the torque. It's difficult to finish very well our treatment. So at the end of the day, we need to bend wires. It's fine to bend wire, but we are, my friends, in 2025. So we need to avoid most of the time this kind of techniques like bend wire, at least just bend wire, maybe in one molar is fine. Maybe at the end of the treatment at the upper second molar, why not? But what about bend wire in all of the teeth? I think it's a technique that I use when I did my residency, but I did my residency, my friends, 25 years ago. And what about the tolerances? Tolerances is about the exactitude of the materials of the wire, for example. Are you sure, my friends, that the wire that you are using in your office is a 19 and a 25? Tolerances is the ability that exists in how well each of these components are assembled or manufacturing. And I'm pretty sure that if you are using DAMON Ultima products, you are really, really using a 19 by 25. The question is why? How come? Because you are using an Orco products. Orco is a company of about 61 years of experience in the world of orthodontics. Because of that, I'm pretty sure that the 19 by 25, that at the slot of 022 by 028 is going to be an slot of 022 but by 028. I was at the factory, at the headquarters of sorry, of Orco maybe 20 months ago, 20 days ago in California. My friends, it's an amazing tour. It's an amazing headquarters. It's everything about technology, believe me. So, when you are dealing with something that I call fly cut braces. Fly cut, in a kind of translation to Spanish, means cheaper braces of low quality braces. Don't forget the name, fly cut braces. If you are dealing of treating your patients with fly cut braces, it's gonna be difficult to avoid this kind of issues, clearance and tolerances. Okay? And most of the time we are dealing with the lack of control 3D. Let me show you this case. It's a beautiful case at the end of the day. This guy had a class 3. He was treated with a facial mask when he was in his mixed dentition. Because of that, the gap in his posterior occlusion, at the upper compared with the lower, a gap because of the McNamara Hyrax and so on, because he had, as I told you, a facial mask. Obviously, we use a passive cell ligation, in this case DQ, to finish his orthodontic treatment of the second phase of his treatment. 4 months later, the patient was wearing a 14 by 25, like whatever JAMON or passive self ligation system. But look at the end of the treatment. Please focus on his upper lateral incisors. At the end of the treatment, and maybe most of you are agree with me, we have to deal with this upper lateral incisor in a proclined position. Most of the time, the upper lateral incisor are flared, and we have to apply torque or bend wire of this kind of spring torque, or whatever kind of tool to create torque, and that's mean time. Maybe at the end of the day, we are able to finish in a good quality our treatment. But the key, my friends, with Damon Ultima is the time. How to reduce the time of the treatments. How to reduce the time of the treatment, okay? Look at the lack of control in this upper and lateral incisor. Why? Why? Because the clearance and tolerances, because the lack of 3D control. Can you see this image, this photo on the left? The upper lateral incisor, the left of the control, and most of the time it's like a fight in a fat guy versus a skinny one. Who's going to defeat the other one? Obviously, the fat guy. Most of the time, in the process of the align and level line, the cuspid of the canine push away the lateral incisor. Because of that, in most of the treatment, the lateral incisor, the upper one, ended up in a proclined position. Just to talk about the lateral incisor. This is a fight between the fat guys and the skinny one. The fat teeth like the upper cuspid versus the upper laterals and whatever other teeth. Okay, look at the end of the treatment, the upper lateral incisor is not a 10, 10 or an A, talking about grades finishing because of the upper lateral incisor. It's a lack of control. It's my nightmare, the upper lateral incisor. So the problem, the clearance and tolerances, excuse me, clearance and tolerances. What about the play between the wire and the slot? It's something similar, the play between the wire and the slot. Look at this image. This was a research that we are finishing with my dear friend, a professor from Cambodia. Look at the play with a DQ2 in a 19 by 25 stainless steel wire in a counterclockwise movement versus a clockwise movement in a 19 by 25. The last wire is a play, if you see the numbers in a chart, of about 13 degrees. Can you imagine this play at the end of the treatment? This play means difficult. How to get the torque, a really, really good torque with this kind of play. Because of that, we needed a new bracket design because the lack of control at the end of the treatment, because the play, let me show you the play. This is the play, my dear friend. Look at a passive ligation slot. Look at a 19 by 25 wire, the last wire, and look at the play, my friend. This is the play. A play of 13 degrees in a clockwise movement and 13 degrees in a counterclockwise movement. And in a clinical way, this is a huge number, 13 degrees. Because of that, at the end of the day, in many, many cases, we need to bend wires to avoid or to overcome this kind of lack of control. Okay? The play. This is a DQ bracket. Look at the play. This is a 19 by 25. Because of that, look at please, the case. This case was treated with for extraction, for premolar extraction. And at the end of the case, the upper and the lower incisor ended up in a retrocline position because the lack of control, because the play. Okay? And again, I did the most difficult. Open spaces to the lateral, open the space to the lateral and to the cuspid. But look at the end of the day how, excuse me, how ended up the lateral incisor in a really, really proclaimed position, and I created a gingivalization on the palatal aspect of the upper lateral incisor. Why? Because the lack of control. Because remember, maybe most of you remember some books, or maybe some of your teacher told you that if you are dealing with a lateral, upper lateral in a palatal position, place or bond a lateral in upside down way, flip around, flip inverted, to get a negative torque. And don't worry, the root is going to move in a buccal way, and then the crown is going to move in a buccal way as well. So you are going to control the torque of the lateral incisor. Yes, my friend, but you are going to move the upper lateral incisor with a round wire. So let me show you this kind of issue. Okay, suppose that this is a lateral incisor in a palatal way. I'm going to apply a best torque measure 3 degrees according to the Andrews, Lawrence Andrews 6 keys of normal occlusion. The lateral is in a palatal way. I bonded a negative torque, whatever kind of bracket, flip around, so or inverted. So at the beginning, I'm going to place an O14. Okay, it's going to move in this way. The lateral even is going to proclaim a little bit more, the lateral, the O14. Then the O18, my friends, no torque at all. Just to push, excuse me, in a forward position and more proclination at the lateral incisor. The O18, no torque at all. But maybe even me, my friends, I did, and excuse me, I made many mistakes when I gave my lectures about 15 years ago. And I used to say that with the 14 by 25, we start to deliver torque in our treatments with the 14 by 25. Let me show you the 14 by 25. Okay? I'm going to place the 14 by 25. My friends, no torque at all. It's a beautiful wire to get a line, level line, avoid rotation, a beautiful arc shape, but we can't deliver or get a torque with a 14 by 25. Look at the upper lateral is in the same position, so we don't have any torque with the 14 by 25. Don't worry about it. When you apply the 19 by 25, you are going to get the best torque. Let me apply or place the 19 by 25. Okay, this is a passive cell ligation bracket, a common passive cell ligation bracket. Okay, I'm going to open the gate. This is the gate of the bracket. And I'm going to place the 19 by 25. Yes, yes. If you see the wire, you are going to move in a better position the upper lateral incisor. Let me show you. Until get this kind of movement, you know, but at the end of the day, please check the image. Please, let me a little bit more. Okay, perfect. Look at my friends that at the end, the upper lateral incisor ended up in a little proclaimed position because the 19 by 25 couldn't get a beautiful torque deliver. Why? I told you, because of the lack of control, because of the play between the wire and the slot. That is a play of about 13 degrees in a counterclockwise and 13 degrees in a clockwise position. Okay? This is difficult. Continue. Because of that, can you see to correct this lateral? Yes, placing wire is gonna be impossible. You are going to apply bend wires of whatever spring torque. Okay. Sometimes we have beautiful ideas in our treatments. Let me show you this treatment. This patient had a class 1 pipro by protrusion, but this patient didn't want extractions. Sometimes with quotation marks, in quotation marks, we need extractions. Why not? Above all, in our people, the people from Indonesia, believe me, is similar to the people in Colombia. Maybe in Europe, maybe in US, in America, there are different, but in Colombia, some people, because of the ethnicity, need extractions. I think in Indonesia is similar, like Vietnam and Cambodia. And can you see that at the beginning of the treatment, apply TATs in a retraction movement, the biomechanics, avoiding extraction, is to distalize with TATs at the infrazygomatic crest and at the buccal shape at the lower. And besides, in search of more torque as a help, bonded the upper lateral incisor and the central as well in an inverted position. Look at the gate. The gate is open most of all of the time to the incisal, to the occlusion. Can you see that this gate is gonna be open in a gingival way? So the bracket was bonded inverted in search of negative torque because this bracket had a positive torque, maybe 13 in this position, is going to deliver minus 13. Again, in search of negative torque plus the elastic chain to the tats. Okay? Okay, look at the result. The result is nice. It's a beautiful mechanics. The position of the upper lateral incisor is beautiful right now. But what about a month? A month later. Oh my gosh. An issue, a periodontal issue, a dehiscency, a fenestration. Why? Because you know, my friends, that the torque move more the root than the crown. That is a mistake. It's a common biomechanical mistakes in our treatment. Bond the braces inverted because when we want or we place a bracket in an inverted position, we create a movement in the roots of the teeth, not in the crowns. Yes, in the crown, but the huge movement is gonna be on the roots, not in the crowns. Can you see the result? This kind of result with the passing of the time, we are going to create a gingival recession. Okay? This is the beautiful of the DAMON Ultima, because with DAMON Ultima, we are able to avoid these kind of techniques like bond braces in an inverted position in search of ideal torque. And my friends, we need to avoid this kind of rationality, of this kind of thinking that we use the torque to move the patient feet in a specific position. The torque was created to another objective, to another goal, and I'm gonna show you what I'm talking about. Okay, this is the play. This is something that I love when we have to dealing with vertical discrepancy due to torque. Yes, because most of the time in whatever passive cell ligation bracket, even in conventional braces, because of this torque is in the base, the gates are different, the slot is different, the center of the slot is different. And if you see this kind of superimposition of a high torque versus a lower one, the slot is different. When we apply an straight wire, the teeth is gonna move in a vertical position. Because of that, when we use variable torque on even, my friends, when we bend wires, the teeth, for example, the upper teeth, okay, the torque is going to deliver, it's going to be in a perfect position, talking about anterior posterior position, but the teeth is going to move in a vertical way. Let me show you why. This is a slide that I love. On the left, high torque bracket. In the middle, a standard bracket. On the right, a high torque bracket. When I apply or I place a straight wire, look at the difference in the slot, in the center of the slot. So that's going to create a vertical discrepancy when we are treating my patient with variable torque or when we are applying a bend in the wires. So it's gonna be difficult because after the torque, I'm going to apply a vertical bend. Because of that, finishing cases in most of the time is difficult with this kind of because of this kind of issues. Let me show you this example. Suppose that I'm finishing this case with low torque, but whatever, for example, the upper central, we need some positive torque at the left upper central incisor. We need a little positive torque. So in this case, I'm going to change the bracket with a bracket with high torque. I'm going to bond the bracket in a perfect vertical position compared with the left upper incisor, with the right upper incisor, okay? Can you see? A perfect position. And then, excuse me, I'm going to place the wire. Can you see the difference, my friend? Because the slots is in a different, the slots, the center of the slot are located in a different vertical position because the torque is in the base of the braces. At the end, I'm going to change the position of the central, and then I'm going to use another band and maybe another band. Because of that, finishing cases sometimes is difficult because this kind of problem. One problem, the vertical discrepancy, another one, the clearance and tolerances, and another one, the play between the slot and the wire. Because of that, we need another bracket. Because of that, we have a new bracket slot design. This is massive. This is excellent. This is amazing. The new bracket slot design, because with the new bracket slot design, we are able to overcome this kind of issue. At the beginning, in the journey of DAMON Ultima, was created the wire, the combi wire. This combi because it's a combination between round wires and rectangular wires, and then was created the bracket called DAMON ULTIMA. It's a bracket that is a slot, is a parallelogram combined with the combi wire that is called right now Ultima wire. We are able to get the torque in a different way. So let me show you the same example of the upper lateral incisor in a palatal way with a DAMON Ultima bracket. Okay, it's the same issue. Remember the upper lateral, my friends, in a palatal way? Okay, but this time we are to do the same example with a DAMON Ultima wire. This is a DAMON Ultima wire, okay? And this is a parallelogram slot, my friend. A parallelogram is like a square, but in a diagonal shape, okay? This is a parallelogram slot. This is a low torque slot that is called retrocline. I'm going to apply the same torque, a perfect one, in a parallelogram slot, the same lateral in a procline position, the same issue. Remember, it's the same issue, my friends, the same issue. So I'm going to start with the same wire sequence. At the beginning, the O14 is the same. So DQ2 and DAMON Ultima at the beginning of the treatment is the same wire sequence, is the same philosophy. O14. Then, my friends, the O18. Okay? The O18, similar, But what about with the next wire? The next wire is not a 14 by 25. The next wire is going to be a 14 by 0275. Why? Because it's a combi wire. It's going to be a wider wire because it's an 0275. It's wider. This is a combi wire, a combination of round wire and a rectangular wire. Why? What happened with the combi wire? Okay, when I played with the 14 by 0275, okay, we are still dealing with the torque, with the procline position. But if you realize we are controlled because of the combi, the anterior and the posterior position of the slot. So we are control the first and the second ordered movement. What do I mean? The rotations and the angulation with the 14 by 0275 we're able to control whatever kind of rotation of whatever kind of tip. Look at that, it's difficult to move in an anterior and posterior position because of the 14 by 0275 compared with the 14 by 025. Look at the gap. Totally different. A lack of control. Look at the control, my friends. It's a huge invention. It's something amazing. What about the next wire? In the last example, I apply or I place a 19 by 25. In this example, I'm going to place the 18 by 25, by 0275, excuse me. The 18 or the 19, the 18 by 0275. Please check. I'm going to open the gate of the wire. I'm going to slide the wire into the slot. Can you see the discrepancy? The discrepancy, I couldn't I couldn't place the wire into the slot, so I need to create a deflection. Okay, look at the deflection. And when I apply the torque, look at the difference, my friend. The upper lateral incisor is gonna be in a perfect position just with the 18 by 0275 because we are able to get a perfect torque position because of 4 points, 4 points of contact. This one, this one, this one, and this one because of the shape of the slot, a parallelograms, plus the combi wire. This kind of combination of round wire and rectangular wire is an amazing bracket slot design, obviously, plus the wire design. Believe me, I knew the wire about 12 years ago, the combi wire. And the engineers in DAMON spent more of 10 years to create an slot to this kind of wire. It was a beautiful work. It was a beautiful job. Okay, the parallelogram slot plus the combi wire. This is the combi wire. We have combi wire 14, 16, 18, 19, 20, and even 21 by 0275 because, as I told you, it's a wider wire that give us more control in first, second, and third order movement. That is called DAMON ULTIMA wire. Obviously, at the beginning, they were called combi wire because of that. I used the former name combi wire, but commercially is known like DAMON ULTIMA wire. It's a round-sided rectangular wire. 14 by 0275, 18 by 0275, even 16, 19, 20, and 21 by 0275. This is the resume of the passive cell ligation compared with a DAMON ULTIMA wire. At the beginning, with a round wire, is the same biomechanics with an O14, with an O18 is the same. DAMON ULTIMA 14 by 0275, whatever kind of passive cell ligation at 14 by 25. Look at that with DAMON ULTIMA, we get rotational control and in and out control. Rotation control and in and out control because of the combi wire. But look at the huge gap in a passive cell ligation bracket. What about the 80 by 0275? Is everything done with DAMON ULTIMA, angulation, vertical, and torque because of the, in this case, because of the parallelogram slot. And look at with the passive cell ligation bracket, a 19 by 25 stainless steel or whatever TMA, it's time to bend wires and so on because we can't get a beautiful result because of the lack of control, because of the play between the slot and the wire. And if we talk, excuse me, if we talk about rotation with this kind of braces, excuse me, we are able to control the rotation as well. This is a 14 by 0275, and with a 14 by 0275, yes, the 14 by 0275 is difficult. Let me show you, my friends. It's difficult to create. Look at that. I'm trying to create that rotation, but I can because the combi wire. Let me show you the same example with a 19 by 25, not 0275, instead by, this is 0275, impossible to move the bracket in a rotational way. Let me show you with the 19 by 25. Okay, this is a 19 by 25. Can you see, my friends? A 19. The last one was a 14. Can you see the lack of control? Why? Because this is a regular rectangular wire. Okay? And maybe at the end of the treatment, if you apply maybe an elastic chain, you're going to rotate a little bit, whatever theta, central incisor. But with a combi wire, this is a combi one, a 14, it's impossible to get this kind of movement. It's amazing, my friend. Why? Because it's a combi wire. It's impossible. It's impossible. Believe me, I'm trying to move the bracket in this kind of movement, and I can't. Okay? It's amazing. Another one, DAMON ULTIMA variable torques, my friend. That is the massive. This is a topic that I love. The variable torque came from the Andrews study. At the beginning, he concluded that this is the measure, this is the numbers, this is the ideal number. 7 degrees at the upper central incisors and -1 at the lower central incisor. Just to talk about the central incisor. Okay? We are going to talk just about the central incisor, but you know that is the same rationally in every single tooth. Okay? This is the goal. This is the plan to get this number in our treatments. 7 at the upper central, -1 at the lower central, lower incisor, central and laterals. Okay? But take it easy. It's not so easy. Why? Because we are treating our patients in different kind of movements, forward movements, and backward movements. Yes, at the beginning, 7 is the magical number. But remember that we are dealing with the play, this kind of play, the 30 degrees in a clockwise movement and the 30 degrees in a counterclockwise movement. Okay? The play, my friends, the play. And in whatever kind of treatment, for example, let me show you this kind of treatment. What about a class 2 elastics? What about an elastic change? What about a extraction of the upper? Oh, my friends, we have to deal with this kind of retrocline position at the end of the treatment. So the ideal number would be 13 degrees, the play plus 7 degrees, the ideal. So the magical number would be 20. Because of that, we need, my friends, variable torques. It's impossible to do beautiful finishing without variable torque. Obviously, if we are treating our patient without variable torque, we need inverted braces or bend wire. Inverted braces is risky, and bend wire in 2025 is something I call it Jurassic or antique. I don't know the proper word, but it's something from 20, 30, 40 years ago, my friend. Obviously, with DQ2, you see we have a high torque and the number is 22, which is good. It's a good number. And this is something that I call, my friends, torque as a protection. Don't forget this number, torque as a protection. What about, on the contrary, we are going to push away the upper lateral incisor? We are going to lose the lack of control to proclaim the upper central incisor. So we have, or we need, this kind of number. -6 at the upper lateral incisor. I think it's a crazy number, -6, a huge negative torque, because torque as a protection, obviously, because with DQ2 we have a 2 degrees in a low torque position, -6. Why not? Because of that, in many, many crowding cases, even with DAMON, we ended up with the proclaim fit at the upper and at the lower because the lack of control. What about at the lower? If we are, why not extractions of whatever retraction at the lower, we ended up with the lower incision in a retroclide position. So the ideal number would be 12. 12. Look at a positive number. We don't have this kind of positive number in our variable torque in DQ and DQ2. No one systems in the orthodontic world had a positive torque at the lower incisor. Maybe we need to place inverted the braces like in MBT from 6 to -6 or from -6 to 6, and with DAMON from -11 to +11, but sometimes place inverted torque. Sometimes I forget it. Even I only use DAMON, but sometimes it's difficult to bond braces in an inverted position. Not difficult, but sometimes we forget this kind of oh my gosh, I needed to bond in a inverted position the braces. Okay. And on the contrary, what about if we are dealing with a crowd? And let me show you this one. This is the result, because the last of control in a class 3 example. Look at the result. Lower incisor in a retrocline position. Can you see? Because we don't have torque as a protection. In these cases, we need torque as a protection, and we don't have torque as a protection. Plus the play between the slot and the wire, plus the lack of control. Because of that, finishing cases is difficult. It's really difficult. Because of that, I love DAMON ULTIMA, my friends. Torque as a protection, remember. Please focus in this concept. Torque as a protection against retroclination movements or proclination movement. For example, in this case, against proclination at the lower incisor or retroclination at the upper incisor. Okay? Tip, most of the cases should be treated considering torque as a protection. Torque as a protection, because we have torque as an action. It's just using torque to bring feet into ideal position, usually at the end of the treatment, that is called torque as an action. For example, if we are dealing with an upper lateral incisor in a flare position and we need low torque, we need torque as an action. For example, in this case, or a class 2 division 2 at the beginning of the treatment, we need to procline the upper central incisors and retrocline the upper lateral incisor. That is called torque as an action. Okay? Torque as an action. Or at the end, if we need to correct something that wasn't prevented during treatment, that is called torque as an action. For example, in this case, look at that, the case ended up in a retrocline position, the upper and lateral incisor. So we need to procline the upper and lateral, and the upper and lower incisor, we need the torque as an action. But most of the times, we need torque as a protection. For example, in this case, at the lower incisors, to avoid the proclination in the level and align process, we need torque as a protection. The ideal number would be minus 14. Torque as a protection. We had minus 11 with DQ2, which is a good number. At the end of the day, this is the goal. Avoid this kind of movement, this kind of proclination or retroclination, whatever you want. Remember, torque as a protection is the most common torque prescription where we need to protect the position of the feet against unwanted moments or uncontrolled tipping. In this example, against retroclination, so we will need a high torque prescription brackets. The most common example is the upper central incisor in class 2 division 2 cases. I'm talking about torque as an action where we need to correct the position of the feet with the support of the bracket prescription. High torque, torque as an action. For example, this case, please look at the upper central incisor. Red dot means high torque. Green torque means low torque. I'm going to change the name because we are talking about DAMON ULTIMA. Because of that, the new torque nomenclature in DAMON ULTIMA is neutral. Neutral means standard. In the former DQ2, neutral. Let me show you the rationality of neutral bracket. It's the same DQ2 slot. Focus in my words. Because of the combi wire or DAMON ULTIMA wire, we are able to control the first and second order movement with a neutral bracket because of the combi wire, because at the end of the day, it's the same DQ2 slot. The torque is just in the base path. And we are dealing with the same, my friends, slot wire play, 13 degrees, okay? Because it's a neutral one, because it's the same DQ2 slot. Let me show you the play. This is a ULTIMA neutral bracket with a combi wire, the 18 by 18, by 0275. And look at the play even. The play is 16 in a clockwise and a counterclockwise movement. So at the end of the day, it's similar to the Q2, but you are using the neutral with a combi wire, so you are able to control the first or second order movement. So, conclusion. If you plan to move feet forward or backward due to biomechanics or treatment goals, neutral torque or neutral DAMON ULTIMA bracket is not a good choice, okay? Please take a photo of this slide. If you plan to move feet forward or backward due to biomechanics or treatment goal, or your treatment goal, neutral torque is not a good choice. Okay. What about Procline? Procline was called high torque. Procline is just to avoid retroclinations. Torque is incorporated both in the bracket base path and in the slot as well. It's totally different because of the parallelogram. Control first and second order with the 14 by 0275 and control third order movement with the 18 by 0275. What about the slot wire play? Please, please focus in this photo. This photo is a research that we are finishing. Please focus in this photo. The slot wire play. Obviously, in a procline, in a counterclockwise movement, the play is a play of almost 30 degrees in a counterclockwise movement. Yes, because it's a procline bracket. Allow the proclination. Allow the proclination. Okay? 30 degrees of play. What about in a counterclockwise movement? 0 degrees. 0 degrees. Avoid totally the retroclination. It's a beautiful bracket. Avoid, completely avoid the chance of retroclination. This is a procline bracket, okay? This is an 18 by 0275. Mm-mm. Oh my gosh, where's the 18 by 0275? This is an 18 by 0275. I'm going to play the 18 by 0275. Okay. This is the photo that I show you. Okay? In a procline movement, obviously, a huge play of about 30 degrees. But what about if we are going to apply a retroclination movement like that? For example, extraction case. It's impossible, my friend. Look at 0 degrees, 0 degrees of play, which is awesome to avoid any chance of retroclination in our patient, in the theater of the patient. Okay? This is procline to avoid retroclinations. And the next one would be retrocline. Torque is incorporated both in the bracket base path and in the slot. Parallelogram shape, combi wire, control first and second order since 14 by 0275. Control third order torque movement since 18 by 0275. Slot wire play in a clockwise movement, clockwise, a play of about 30 degrees. What about in a counterclockwise movement? 0 degrees. A perfect. This is a student, a research at the university. This is not a commercial photo, my friend. The research was did in a university, in my university, combined with some colleagues in Cambodia. It's a beautiful research. Okay, this is the truth. So if you plan to move feet forward due to biomechanics or treatment goals, please take a photo of this slide. Retrocline torque prevents any chance of proclination. If you plan to move feet forward due to biomechanics or treatment goal, retrocline torque prevents any chance of proclination. At the end of the day, we don't have to procline. We need to move in a forward position. No proclination, just to move in a forward position without uncontrolled tipping. This is something that I call torque as a protection. But if you plan to move a selected backward due to treatment goals, retrocline torque allows backward movements until reaching the ideal Andrews prescription, 7 degrees. That is something that I call torque as an action, okay? But This is something, excuse me. Oh, my friend. This is the new name. Procline, avoid any chance of retroclination. Retrocline, avoid any chance of proclination. If you need to procline, torque as an action, obviously use a procline bracket. If you need to retrocline, torque as an action, you can use a retrocline bracket. What about the neutral? Neutral, I just use neutral bracket just for a few simple or straightforward cases. But most of the cases, I don't recommend neutral bracket because it's the same biomechanics that we have to deal with the play between the wire and the slot. Okay? And the best one, the center level slot line up, so we don't have to deal with vertical discrepancy if we are using variable torque. You see the slot line up is in the same position. Because of that, we don't have to deal with vertical discrepancy. This is something that we call in Orco the torque teaming. When different variable torques are used, they work with each other to change the progressive slot geometry. This effect is to center the wrong wires more than a rectangular slot, resulting in an improved alignment in round wires. And when we are using different variable torque, even the 18 by 0275, we don't have to deal with vertical discrepancy. Let me show you. I'm going to superimpose a retrocline slot and a procline slot. This is a procline, and they are in the same position. Can you see? The same center of the slot, and because of that, excuse me, it's the same center of the slot, the retrocline and the procline. So we don't have to deal with vertical, okay? We don't have to deal with vertical discrepancies. Torque teaming is a beautiful, beautiful help to us. The prescription is perfect. The prescription is perfect. The DAMON ULTIMA prescription is perfect, my friends. For example, if you want to use in a perfect position at the beginning of the treatment, you don't want to change the beautiful position at the beginning of the treatment, and you don't apply forward or backward movement. Maybe the perfect prescription would be the Andrews prescription, 7 degrees, not 12, like DQ2. So the prescription on neutral upper central incisor is 7 degrees. Only straightforward cases. What about torque as a protection? Remember that I told you that the ideal number would be 20? What about procline bracket in an ULTIMA? Yes, it's 20. It's 20. And what about torque as a protection? Talking about retrocline, I told you that this is a crazy number, -6. We have 2 degrees with DQ2, but -6 would be a, I don't know, weird number. What about DAMON ULTIMA? Yes, it's -6. It's a perfect prescription to avoid any chance, in this case, of proclination if we are dealing with acute crowding or something like that. Open coil springs to relieve crowding. Yes, crowding, open coil spring, class 3 elastics, upper lateral in class 2, these two cases. What about the lower? Remember that I told you we don't have a positive torque with the Q2, any system. We need to inverted bone inverted braces. Yes, we have procline braces with DAMON ULTIMA. It's beautiful, and it's 12 degrees, the perfect number, 12. Class 3 elastic, lower extraction, closing lower spaces, and so on. What about the low torque minus 11? Right now is retrocline, it's called retrocline, and it has the ideal number minus 14 to avoid proclinations, class 3 elastic, advancing mandibular propulsion, lower crowdings, open coils, increase deep curve of speed, and so on. This is a close friend. He was in the last forum uh, in Asia, Steve War. Steve, most of the time, they they is dealing with me and argue with me that the only thing that you have to think is that the goal, for example, about central incisor is 7 degrees, 3 degrees and lateral and so on. But I love the numbers, I love biomechanic because of that more at the times I show the real prescription of Damon Ultima to show you, just to show you, my friend, that in my mind I'm professor of biomechanics of about 20 years ago of my mind. Believe me, I'm an academic guy as well. I'm a teacher. And believe me, the prescription is perfect. And the prescription, look at the difference between a neutral, a procline, and a retrocline bracket. It's the same bracket, the same architecture. The neutral, the procline, and the retrocline is the same architecture. But look at the difference. I'm talking about torque. Neutral. The base, the bottom of the slot, 7 degrees. Procline, the base, the bottom of the slot, 7 degrees. Retrocline, the base, the bottom of the slot, 7 degrees. It's the same 7 degrees. Made the difference between procline and retrocline, and that they have additional torque into the slot. But at the end of the day, talking about just upper central incisor, the goal is 7 degrees. The Andrews 6 keys of normal occlusion. Why at the neutral look at 7 degrees wide spin? Because they play. Because they play. We don't have play in procline and retrocline. Let me skip these slides because of the time, because I want to show you some cases, and the time flies in webinars. I have a lot of material to show you, but I just have 30 minutes. Let me show you some of cases with my reside for variable torques with DAMON Ultima, my friends. Obviously, in a generic passive cell ligation with a 19 by 0275 full size wire, we have to deal with the play. But because of the, as I told you, retrocline or procline, we avoid this kind of play. So let me show you a mild crowding case. This is one of my result. If you see green dots mean retrocline, red dots mean procline. Most of the time in these kind of cases, mild crowding cases, I use retrocline braces at the laterals and central, and sometimes procline braces at the cuspid. Why? Why at the cuspid procline braces? Please check the buccal corridors of your patient. Think about function. Check the root position of the cuspid. And if you are going to use elastic chains or whatever mechanic that you are going to apply on the cuspid, you need procline torque. Why? Because with the procline torque, we avoid rotation. Rotations. Why? Because of the combi wires avoid rotation. So because of that, I tell you, please try to use, in most of the cases, procline variable torque at the upper and lower cuspids. Okay? For example, look at this case. Look at the root position in this upper cuspid. In this upper cuspid, we need to hide the upper root at the upper cuspid. Okay? So in this case, in this case, and we need to apply a vertical force to get a proper occlusion, and you know that the vertical movement is going to move the crown in a palatal way, biomechanics. So the perfect variable torque would be, in this case, is proclined at the upper cuspid. Because of that, not in all of the cases, every single patient is an every single biomechanic, but I'm going to try to give you a kind of recipe. Most of the times in cuspid is gonna be advisable procline braces. Procline braces at the upper cuspid. Let me show you a case. This is a simple case. Look at, my gosh, look at his beautiful corridor. It's a simple case, some kind of crowding in his upper lateral incisor. It's a class 1 patient, some proclination at the upper incisors. At the beginning of the treatment, can you see the crowding at the upper incisors? At the bottom, the crowding, mild crowding at the upper. Think about IPR. Most of the time, I try to apply IPR at the lateral, just the lateral incisors. And this is the variable torque that I told you. Retrocline at the upper and lower incisor, procline at the upper and lower cuspids. This is a good choice, good choice in this kind of cases. So if you are treating a crowding, no matter the discrepancy, the best option is retrocline. Maybe the doubt is about the cuspids, and procline is gonna be a good choice, my friends, most of the time. And this is something that I call, remember, the two concepts, torque as an action and torque as a protection. This is torque as a protection. Protection against proclination. If you need to avoid proclination, easy, use a retrocline bracket. If you need to avoid retroclination, easy, use a procline bracket. Okay, this is my tips. Place the braces. Okay, to avoid any chance of proclination. Use an elastic chain, stainless steel, figure 8 lace back from molar to cuspid, some IPR at the beginning of the treatment, at the beginning in my tips. Remember, yes, why? Yes, against proclination, we are going to use retrocline bracket against proclination. But remember, my friend, that at the beginning of the treatment, we are using round wires. Round wire. The O14, the O18s. And round wire means no contour at all. So at the beginning of the treatments, the control is not the torque. The control is our minds, the biomechanics. And maybe in the next seminars or webinars on the basics in person, I'm gonna show you a plenty of tips to avoid this kind of proclination and retroclination. And the goal, remember the goal, reduce treatment times. Okay, this is for example one of my tips, and I have another one. Look at, can you see, did I cut off the wire at the lateral lower incisors? Yes, to avoid proclination at the beginning of the treatment, because the patient is wearing a no 14, no torque at all. Oh, no problem. You are going to bond a retrocline bracket and no proclination at all. I don't believe you. Why? Because the patient is wearing a wrong wire, no torque. At the beginning, you need your mind. You have to think to avoid this kind of unwanted moments. My God, the time flies. Okay? 10 weeks or 18, 4 months of treatment. Look at the 14 by 0275 from 014 to 018, from 018 to 14 by 0275. For 0275, maybe one additional month, excuse me, with 14 by 0275. It's time to place some elastics to close the spaces, to avoid this kind of cant in the occlusal plane. This is an elastic that I love. It's my preferred one. The rainbow elastics. I love it. To avoid any chance of open bite, or to close open bites, or to improve the overbite. 6 months later, the patient is wearing an 018 by 0275 copper night tie at the upper and at the lower as well. The 18 by 0275. We are just with copper night tie in this phase of the treatment. Okay? My preferred one, elastics. Beautiful. Love it. Love it. This is an 04, 3.5 ounces, a medium one. Okay? Most of the time, I don't use heavy elastics, 6 ounces. Yes, 6 ounces is if the patient is wearing an stainless steel or TMA wire. That's in copper nighted, yes, medium. Excuse me. Can you see that we are able to finish the case in just 7.5 months? Why? Because of the biomechanics. Think about it at the beginning of the thing. And because of the beautiful torque delivery with DAMON system, with DAMON Ultima, and the best. I was able to finish this treatment just with copper night tie wire. We didn't use, or the patient didn't wear, TMA or stainless steel wire. Obviously, this is just one case. I have many cases finishing with TMA or stainless steel, but I have a lot of cases finishing just with copper night tie in copper night tie at the end of the treatment. Okay, look at the beautiful change from here, the IPR, 18 by 0275, 6 months of treatment, and just in 7.5 months, the final. Yes, if you realize at the end of the treatment, the lower incisor are proclaimed, but a little bit. That is good. That means function. That means a beautiful interincisal angle. The former rules about that the best number, talking about lower incisor in 90 degrees. I don't believe in this kind of rules. Like a friend said, new tools like DAMON Ultima, new rules, my friends. Don't worry about this phrase. New tools, new rule. But maybe Steiner, Jarabak, Ricketts, McNamara, they didn't have DAMON Ultima, but we have DAMON Ultima. We have a beautiful tool, and this kind of measurement. I don't believe that the stability of a specific treatment came from a specific measurement. And if you see in a clinical point of view, the lower incisor are in a beautiful position, even in a 94 or 95 angle with its mandibular plane. I think it's a beautiful finishing. And yes, the beautiful is the number 7.5 month of treatment. At the end of the treatment, beautiful interincisal angle. Just a slight proclination. And can you see that the buccal corridor are totally different? A beautiful smile arc at the end of the treatment. And the best, I think, is reduced treatment time with DAMON Ultima. Let me select another patient because of the time. It's 8:17. I love, for example, this patient. This is a class 3 patient. Okay, this is a class 3 patient. No, this one. This is an open bite. Open bite. These open bites are difficult cases. Most of the times, my friend, this is a beautiful variable to reside for open bites cases. Retrocline at the upper and on the lower. Even sometimes the cuspid as well. But remember that we have to select the case just at the cuspid, procline or retrocline. But open bites, the beautiful or the best choice is retrocline braces at the upper and lower. Incisor. Cuspid, think about the position of the cuspid at the beginning of the treatment. This is a colleague. She's a dentist that started to work at the university 1 month ago. I met her and I showed her face, her huge open eye, and I told her, Doctor came to me, you are starting to work in a faculty of dentistry, in an orthodontic department. She's not dentist, she's microbiology, something like that. And I told her, please, I need to correct your teeth because you are start to work with orthodontic. She started to love, but she told me, look at Dr. Perdomo. The issue is that I don't have enough time because I'm going to travel to Canada the next year and I don't have just 1 year to this kind of treatment. And I know and I have heard that the orthodontic treatment, most of the time, you spend 18 months, and most of the time, 2 years. It's going to be a long treatment, and I don't have enough time. I don't want to travel with braces, or that you remove the braces in the middle of the treatment. So please, I don't want this kind of treatment. And I told her, let me make you a promise. I'm gonna finish your treatment in less than 1 year or just in 1 year. I don't believe you. You are a man, she told me. And I told her, please try to believe me. I'm not a man, I'm a doctor. Fortunately, she believed me. Look at the day, August 2023. A huge open bite at the beginning of the treatment. She lost an upper cuspid because some cavity. Treatment plan in torques. Maybe because why low torque, excuse me, retrocline at the lower because the open bite. Why procline at the upper incisor? Because I'm going to do a huge retraction because she had an open space and she had, if you realize a cavity. Can you see a cavity at the upper right, left second bicuspid? Because of that, the treatment one extraction of this upper bicuspid because she didn't have the right one. Rationally, biomechanics, common sense mechanics, extraction of the right one, upper left bicuspid. Because of that, procline at the upper central incisors. At the beginning of the treatment, let me check. Procline, retrocline, procline, perfect. This kind of tongue tamer because the lady had a tongue throat. I apply tats at the palate and infrazygomatic crest because the biomechanic was to intrude the upper molar as well. Because the biomechanic to close an open bite is to treat the occlusal plane, not only extrusion at the upper incisor, but also intrusion at the upper molars. It's biomechanics, okay? My preferred elastics, I told you, I love it. Biomechanic, intrusion, extrusion, intrusion, extrusion, intrusion, extrusion. close the upper spaces, intrusion, extrusion, control the tongue, my preferred elastic, February 2024. Remember, I started in August 2023. Closing the upper spaces, February 2024. Can you see the change in her profile? Obviously, maybe most of you are thinking that she's a surgery case. Yes, she is, but she rejected the surgery as a treatment option. She didn't have enough time for orthodontics. What about for a surgery? Even her mandibles were rotated a counterclockwise position because of the intrusion of the upper molar. March, patient is wearing 18 by 0275. I'm still closing the upper spaces. And please check that she's wearing a copper nitride at the upper, but an stainless steel 16 by 0275 at the lower. But why? Why? An stainless steel at the lower? Because I needed to change the edge for and the lower to wide a little bit more. Because of that, I needed an stainless steel. Okay. May 2024, I changed to TMA at the upper, 19 by 0275, obviously because I needed some kind of arch, specific arch form, some kind of bend at the end of the treatment. May 2024, June, 10 months later, believe me, just 10 months later, and look at the change in her face. She's really, really happy with a beautiful smile at the end of the treatment. Obviously, her profile was improved. Obviously, maybe right now she needs just a mentoplasty, a genioplastia, and that's all. Beautiful overbite. Maybe she traveled with her tat in her mouth. My God, I don't remember very well. Okay, a beautiful class one. Please check the position of the upper incisor. Beautiful torque deliver because of DAMON ULTIMA. Remember, the goal is reduce treatment times. And a beautiful arch form at the end of the treatment. Can you see the cephalometric? Obviously, why not a genioplastia? Maybe when she came back to Colombia, could be. Yes, a genioplastia is gonna be awesome. In just 10 months, my friend. That's the goal of Damon Ultima. That's the goal of Damon Ultima. Reduce treatment times. So let me finish, my friends, the webinar, the today's webinar with this. I think it's a challenge case. Obviously, the advantage is a young guy, and you know that in young guys everything is easier. He had transversal issues, crossbite, narrow arches, vertical issues like the deep bite, but the deep bite is gonna be an advantage, and I'm gonna tell you why. And sagittal problem may be a huge overjet at the beginning of the treatment. The advantage, the deep bite, the advantage, his age. The pant, I don't see anything special at the palm. What about the cephalometric? Can you see the overjet at the beginning? Please check the overjet. A huge overjet, a huge one. An overjet of about 10 millimeters at the beginning of the treatment. My God. Initial, please, my friend, check the date. August 2023. A huge overbite. But the overbite in this kind of cases, believe me, is a huge biomechanical advantage. It's a excellent biomechanical advantage. It's a class 1 case. Looks like a class 2, but it's a class. Oh my God, look at the crowding at the bottom. We need extractions. It's impossible without extraction. Or at least it's gonna be a treatment of I don't know, 2.5 years. But we are treating our patient with the best appliance, Damon Ultima. The goal, reduce treatment times. Okay, the deal, extraction versus non-extraction, but think about it, facial-driven treatment. The face, the lips, the profile, we don't need extraction. Torques, remember the torques as a protection against proclination, so we need retrocline braces. And mechanics, think about why not some IPR, why not some digitalization, why not TATS, why not a phrase that I love, common sense mechanics. Okay? And this is something that I love. This photo, this one. Look at the common sense mechanics. An open coil between the central and the cuspid, between the central and the bicuspid, avoiding, my friends, avoiding the proclination at the lower incisor with an O14 at the beginning of the treatment. At the upper, yes, I tie the lateral at the beginning, but every single, focus on my words, every single appointment is an every single treatment. It's a different treatment. In every single appointment, you reevaluate your biomechanics, okay? This is something that I love. The open calls to create a space, low forces. The key of this low, maybe you are thinking about that I'm going to apply a lot of force in this central lower incisor. No, the key is just low forces. I'm going to activate this open cold in 3 months. In 3 months. The key is low forces. 1 month of treatment at the end of the August. The same biomechanics. The same. We don't need to change the wire. That's been low force. That's been Damon system. It's the same philosophy, but with a different tool. But it's the same philosophy. The third appointment, still with an O14. That is the key of the passive cell ligation with Damon system and with Damon Ultima. Maybe the difference is that I tied the lower central and lateral left incisor and I untied the upper right lateral incisor because I realized that maybe I'm going to proclaim the laterals. So it's time to untie. It's a matter of biomechanics. Every single appointment is an every single treatment. 3 months later, just 3 months later, the patient is wearing an O18 at the upper, an O14 at the lower. Look at, this is my preferred biomechanics, bottoms at the palatal or lingual aspect, plus a elastic thread tied to the open coils, avoiding proclination and avoiding proclinations. 4 months later, the patient is wearing 14 by 0275 before tying the laterals at the upper and at the lower. Look at August, September, November, and at the end of November, August, please check, September, October, November, with even with wrong wires at the bottom. 5 months with wrong wires. O14, again, the O14 at the upper and at the lower. Why? Because I tied the laterals at the upper and at the lower. We need low forces. December, I placed the 14 by 0275 just at the upper and 018 at the lower. Okay. If you are seeing deflection, remember, deflection means movement. If you see deflection in your wire, please don't change the wire because deflection means movement. April, remember we started the treatment in August. April, 14 by 0275 at the upper, 18 still wrong wires at the lower. Low force, that's why, because of some kind of deflection. Look at the the lower lateral on the right. We need some deflection. We saw some deflection on the wire. June, 10 months later, 18 of 275 at the upper, 14 by 0275 at the lower. Class 1, beautiful engage. Look at the upper arch and the lower one. Maybe we need some repos. Look at when I saw this smile, this photo, I realized of some kind. I didn't like his smile. It's time to reevaluate. Maybe he had his upper incisor a little bit wider, a huge upper incisor. Because of that, I took the decision some kind of IPR, more than IPR, a kind of reshaping. Remember this kind of beautiful paper of David Sarber about proportionality at the central and upper laterals? Because of that, more than IPR is like a reshaping to create a beautiful arc smile and to create a beautiful teeth shape at the end of the treatment. And look at right now his beautiful smile at the end of the treatment. In jet, my friend, a challenging case, huge crowding, severe crowding, excuse me, without distraction in just 12, 12 months of treatment. 12 months of treatment. Please check the position of the upper incisors, the lower ones. No procrastination at all. Remember my nightmares, the upper laterals? Remember that the most of the time the upper laterals ended up in a proclined positions? Okay? A beautiful case. A beautiful case because of the DAMON ULTIMA, because of the passive delegation, because of the combi Y, and because something that I love, variable torque, my friend. So, at least in my country, my friends, the vast majority of orthodontists choose low-cut system and conclude brackets at brackets. What truly matters is biomechanics, my friends. It's funny, these kind of phrases. But if we want to succeed in life, we must be different. Step out of our comfort zone. Learn and learn every single day. And believe my concept, my rationality, my way of thinking. I believe in technology. An open mind always allow us to grow each day, but personally and professionally, while wisely embracing the tools like Damon Ultimate that guide us closer to our highest goals. So, thank you so much, my friend, to join me, to be with me these just 90 minutes, and I hope to see you soon. I hope, hopefully, in person. Thank you so much to be with me.
Brilliant stuff, Dr. Padermo. The really insightful 90-minute webinar, and thank you to the doctors for joining this session. Great explanation of the geometry and engineering behind Damon Ultima, and then of course the cases to conclude your webinar were mind-blowingly fast. Really impressive to see. We do have some questions in the Q&A box, which is great. So thank you to those doctors that have taken the time to ask some questions there. So would you like me to read them out for you, Dr. Padermo, or you've got them there?
Can I? Okay, I'm seeing the shot.
Great.
Okay.
I'll start reading some of them out for you there, Dr. Paterno.
Okay.
So Dr. Andrews asked the question, if a patient is requiring premolar extractions, what kind of torques would you recommend?
Perfect question. It's a beautiful question, doctor. Most obviously depend at the end of the position of the upper and lower incisor at the beginning of the treatment. But if you wanna reside most of the time at the bottom, Procline braces is the perfect torque, variable torque. Procline at the bottom and at the upper, procline except the upper laterals. But remember my key, remember my tip, my pearl. Most of the time the upper laterals ended up in a procline position. So my key is to use retrocline even with extraction. So resume. At the bottom, procline braces. At the upper, procline, except the upper laterals, that the best choice is to use retrocline. I want a beautiful extraction cases, but I didn't have enough time to show you extraction cases, but this is the perfect variable torque option. Procline at the bottom, retrocline at the upper laterals, and procline at the central and cuspid upper teeth.
Fantastic. Okay, the lingual buttons that we used in that deep bite case on the lower incisors, what was the purpose of using those lingual buttons there?
Yes, it's a nice question as well. It's because the position of the lingual button is gonna be closer to the center of resistance compared with the position of the bracket. The bracket most of the time is in the center of the crown. Let me, I'm gonna change. You are watching my camera as well, yes? Yes.
Yep.
Okay. When I place when I bond a bracket, this is a bracket in the center of the crown, okay? When we apply a force, the center of resistance is further. Because of that, I'm going to deal with this kind of moment in a negative way, or this kind of moment in a positive way, a moment to force, yes? But when I place a bottom, the bottom is placed as gingival as possible, and because of that, I reduce the distance from the bottom to the center of resistance. So the moment to force is going to be reduced. So the chance of proclination, yes, is going to be a proclination, but yes, a few proclination. Yes, I'm going to reduce the proclination because the distance is reducing from the bottom to the center of resistance. Plus the elastic thread. The elastic thread is less force than a copper 90 wire. Because of that, this is my tip, my tool. Avoid the wires in these kinds of teeth that I in a forward position of the arch, like in a lingual aspect or a palatal aspect. I prefer buttons plus elastic thread. And please, the tip is to place or to bond the bottom as gingival as possible, okay? To reduce the distance from the center of resistance to the bottom and reduce the moment to force, okay?
Okay. On that last patient as well, Dr. Badermo, a doctor has asked at what stage, when did you place the TAD in that case?
In the last case,
Yeah,
no, in the last case, I didn't use that.
no TADs. There you go.
I write down in a slide that that could be an option, but no, I didn't need that because I realized that just with the passive self-ligation expansion, with the open case, just patient, biomechanics, don't rush to change the wire. We are going to do a beautiful treatment. Remember, the patient is a class 1 patient, and most of the time in class 1 patient, except class 1 by protrusion, we don't need that. The patient was ideal because the patient had a deep bite, huge crowding, but deep bite means that we are able to procline the upper and lower incisor. So most of the time, these cases has a beautiful, good prognosis. Did by plus severe crowdings plus class 1 without by protrusion. Okay? We don't need that in this kind of case.
Wonderful. Great question here regarding bracket placement in terms of, is it similar or different to Damon Q2 with Damon Ultima?
It's a little bit different, but if you want a tip, the key, look at my friends, this is a beautiful tool. And remember that the key, if you love torques, if you know biomechanics, the key is the center of the crown. The key is the FA point. Again, the key, let me, this is the key, my friends. Most of the time, the center of the crown. Maybe there are a few exceptions in open bias or depth curve of speed. If we need to level line the curve of speed at the lower bicuspid, maybe a little more gingival, maybe in an open bias, a little bit in a gingival position. But most of the time, 90% of the cases, the key is the F8 point. But I have many, many tips and rules, but we don't have enough time. But for now, I tell you, the key is the center of the crown, the FA point to deliver the perfect torque expression.
I think we'll do one more question. That last case has obviously got everyone thinking here. And question is, if that last case was actually in class 2, how would you treat that case? Would it be any difference there?
Yes, would be a totally different case. Maybe if the patient was a class 2, could be a good option, touch at the upper. Why not?
Mhm.
In class 2 patient, most of the time I use tats at the infrazygomatic crest. Is a beautiful tool to distalize the upper arch. I love tats. I have a beautiful lecture about that. For me, the best tool is the combination of tats and passive cell ligation. Is a perfect match. It's a beautiful match. So in most of the class 2, I use tats at the upper. Obviously, depends of the issue. If the issue is in the maxilla, that is the answer. What about if the issue is in the mandible? If the issue is in the mandible, we need mandibular propulsion. I don't know if in Asia is popular the mandibular propulsion. Depends of the ethnicity, because most of in Asia the population is class 1, some class 3. But in this area, in America, we have to deal with a lot of class 2 because of the mandible. Because of that, I use a lot mandibular propulsion, because I have to deal with a lot of class 2 because of the mandible. But if you have to deal with class 2 because of the maxilla, the answer is that's at the opera, infrazygomatic crest.
Okay. Actually, just one last question, Dr. Badum, if you don't mind. I do understand we're a little bit over time, so thank you. If we're going to retract all the maxillary retraction using the IZC both sides and a non-extraction case, what torque on anteriors would you recommend?
Most of the time, proclaim, talk as
Yep.
a protection. Remember, talk as a protection against retroclination. Because if you are going to distalize, this upper central incisor, at the end of the treatment, you are going to deal with a retrocline position. So you need something that protect your upper teeth to this kind of movement. The answer is torque as a protection, a procline bracket at the upper incisor, a procline bracket at the upper incisor. Remember the concept, torque as a protection.
Great answer. Yep, love it. All right. Thank you so much, Dr. Padermo, for taking the time to answer those questions so succinctly, and again for a brilliant webinar. And we really appreciate your time here in Southeast Asia, and we look forward to seeing you in person, no doubt, again soon. And thank you to the doctors for joining us tonight. And have a great day, everybody, and we'll see you soon. Thank you.
Thank you. Thank you, Dane.
Thank you, Dr. Padermo.
Thank you, Dr. Padermo. Have a great day.
Have a great day. Thank you so much for joining me.
Okay.
Recording stopped.